So today I'll be discussing about the various problems you can face if you have PCOD and how to tackle, how to prevent and protect yourself from those problems. So one of the most common things that a lot of patients come with is irregular periods. So they are not prepared for their periods. That is one thing. They can have very excessive bleeding. They can have bleeding after 2 or 3 months, and then that bleeding might not stop for 15-20 days together. So this leads to a lot of blood loss, causing problems such as low hemoglobin, that is anemia. That is one thing, irregular periods. Second is cosmetic concern. If there is a lot of thick hair growth over the chin and mustache area, a lot of girls feel very awkward and conscious because of that. And they say that earlier they used to remove once every month, and now they have to remove once every 1 week, and still it becomes and it doesn't look good, and they are embarrassed in their social circle. That is one more cosmetic concern. Third is that anyone with PCOD is at higher risk of developing diabetes. It is mainly because of the weight that is associated with it, and insulin resistance is the main disease process behind both the things, behind PCOD as well as diabetes. So this is one more thing, that you are at higher risk of diabetes. So you should try to maintain an ideal BMI and try to check your sugars and insulin levels also in the body, so that you are more aware that such a thing can happen and you take preventive steps early on. Another thing that a lot of people face nowadays is infertility because of PCOD. So in PCOD what happens is that a lot of eggs start developing at the same time. Now normally in a woman's body, every month one egg develops, it becomes big, comes inside the fallopian tube, and that basically merges with the sperm, and that causes pregnancy. In PCOD that one egg doesn't mature, so there are multiple eggs, and that can cause infertility. So that is one more problem that a lot of people with PCOD encounter. Again, untreated PCOD has been known to be associated with cancer of the uterus as well. That is one more problem. Another problem is snoring during the night. So some people snore very heavily. If they have PCOS, they are at this risk. We call it obstructive sleep apnea. They are at higher risk of that. They snore very heavily during the night. As a result, they wake up multiple times in the night, and in the day they don't feel fresh. They are not as fresh as they would be, if they had a good night's sleep. That is one more thing. Again, PCOD people are known to be at higher risk of depression as well. So these are the complications that you can face when you have PCOD. So what to do about it? So the simplest and actually the most important treatment which I tell to all my patients if you have PCOD, lifestyle modification is the main treatment for you, which is going to protect you from all the complications and problems that will happen due to PCOD. So what is lifestyle modification and what do you need to do? So there are two components in lifestyle modification. One is diet and another is exercise. So diet, again I would say that healthy eating. So that is if your BMI, that is your weight in kgs divided by your height in meter square is it is more than 23.5, then lose weight. Again, if you come to us, we will help you in that also. We will make diet plans for you which are specifically directed towards you, and we basically tell you to cut down on calories. There are various methods with which you can do, but the main thing is carbohydrate content should not be very high, which is there in most of our Indian food. We eat a lot of rice and chapati. So basically cutting down on that, eating healthy things like lot of salads will be very good, fresh fruits, vegetables. So these things basically, and cutting down on your carbohydrates, cutting down on your oil, ghee or butter consumption. Again, this is one thing I tell to all my patients. Your oil, butter or ghee for one member for 1 month in the family should be not more than half liter. So if there are 4 adults in the family, you should restrict your oil to 2 liters in entire month. Again, it is when I say this, a lot of people laugh that what I am saying, but this is how it should be. So cut down on your fat, that is on your oil, ghee, butter, on carbohydrate, that is cut down on your rice, and everything that we eat, basically idli, dosa, all these things are very carbohydrate rich. So try to shift to better options like pesarattu, godum rava upma, oats, and have lots of salads, fruits, all these things. So that is the diet component. The second component is exercise. For any PCOD patient, at least half an hour of exercise every day is extremely important. even if they are maintaining normal BMI, even if they are lean. Nowadays we see a lot of girls who are not obese but they have PCOD. So even for such patients, exercise makes a big difference. Once you come to your normal weight, or once you just start exercising, the periods might become regular, your hair, the facial hair growth that you had might come down, and the infertility problem might get solved. So this is something which is at the center of the treatment for PCOD, and it is something which is completely in your hands. You don't require anyone else, you don't require any treatment for that. So for any PCOD patient, my message right now will be maintain an ideal BMI, eat very healthy food, and exercise daily for half an hour.